everyone. I am Lourdes Jane Hordista Renoblas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for administering oral medication. Medication is a substance administered for the diagnosis, cure, treatment, or relief of a symptom or for the prevention of disease. Oral medication refers to medications taken by mouth. They come as solid tablets, capsules, chewable tablets, lozenges, or as drinkable liquids such as drops, syrups, or solutions. The purpose and significance of administering oral medication is to provide a medication that has systematic effects in the gastrointestinal tract. Mayong adlaw, sir. First is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to check for the client's identification band. This is done to ensure that we are carrying out the correct procedure with the correct patient. This will also enable the nurse to assess the patient's conditions and needs more accurately. Next is to assist the client to a sitting position, or if not possible, assist client to a side-lying position. Sir, pwede mo bakod ta, sir, and malingkod ta sa imong higdaanan? Sige, bakod lang ta na, sir, ha? Then, sandig lang diri, sir. Ano, sir? Comfortable ra ka sa imong position, sir? Sitting upright as possible will make the swallowing of medication a lot easier for the patient. Next is to explain the purpose of the medication and why it is important to the client. Sir, ang vitamin C ato ni siyang tumaron aron mapaligon ato ang immune system. Aron kita maprotektahan laban sa mga klase-klaseng sakit. Nakasabot para ba, sir?
Oh, nurse.
Okay. Providing information to your client will minimize anxiety and fear, will foster trust, and will promote client cooperation. Next is to administer the correct dosage of medication at the correct time. Taking the medication too soon or missing a dose will result in ineffective medication. Next is to give the client sufficient water to swallow the medication. Sir, tubig, sir. We should be aware of any fluid restrictions that may exist. Next is to use the medicine cup to introduce the medication in the client's mouth. Sir, nga lang, sir. Nga lang po din, sir. This is done to prevent handling the medication so as to prevent contamination. For sublingual medication, instruct client to place the medication under the tongue and allow it to dissolve completely. The body would be able to absorb accurately if it were in the sublingual gland. For buccal administration, instruct client to place the medication on the mouth against the cheek and allow it to dissolve completely. The body would also be able to absorb accurately if it were in the buccal pouch. For nasogastric tube, crush medications and dissolve the powder in 20 to 30 ml of water in a cup. Dissolving medications will prevent difficulties when administering via internal tube feeding. Next is to record the medication given, the dosage, time, and any complaints and assessments of the patient in the patient record. wash your hands.